The scientific and medical community horrified and pushing back on an executive order President Donald Trump signed just minutes ago, which aims to reduce the number of recommended childhood vaccines and split up some vaccines into separate visits. These are dramatic changes that go against broad scientific and medical consensus, but they are in line with Donald Trump's own consensus on vaccines that is not backed by science or evidence.
Large amounts of vaccine, large amounts of vats of vaccine are currently pumped into your child's body. And we're doing 20% of that at each visit. Nothing bad can happen from what we're doing. Nothing bad can happen.
Nothing bad can happen. Famous last words. Trump in recent months has pressed HHS Secretary Robert F. Kennedy Jr., who has no scientific background and no medical training, for more action on the childhood vaccine schedule, as well as a continued search for links between vaccines and autism. For decades, there have been extensive studies of vaccines that have yielded no evidence of a connection to autism. So Trump's childhood vaccine shakeup is being called out by the medical community, including Republican Senator Bill Cassidy of Louisiana, a trained physician who was the deciding vote to confirm RFK Jr. as HHS Secretary. The outgoing senator, writing on X, quote, "I'm a doctor. This executive order is wrong. The president does not have the expertise to make these changes. Vaccines are overwhelmingly safe. Vaccines are effective. Vaccines do not cause autism. Parents should listen to their child's pediatrician about vaccines rather than listening to an inaccurate executive order. This is so wrong," unquote.
Decades ago, children received only a small fraction of the vaccines required today. In those times, people were much healthier, and of course, the high rates of autism now observed did not exist. So there's a reason for such epidemic rates of autism.
We should note, extensive scientific research by actual experts has found no evidence of a link between vaccines and autism. The executive order also moves to split the combined measles, mumps, rubella vaccine, or MMR vaccine.
So the MMR, we want to have separate visits, separate times. And I saw this early on, and I've seen proof of it, where they have a vaccination that looks like the size of a bottle of soda poured into a little child's body. And bad things happen in too many cases, because this is an explosion. This is an epidemic.
Separating the MMR vaccine is a change President Trump has long sought, not because the combined shot isn't safe and effective, not because medical experts and scientists think it's something that should happen. It's because President Trump feels this change should happen.
The MMR, I think, should be taken separately. This is based on what I feel, the mumps, measles, and all the three should be taken separately. And it seems to be that when you mix them, there could be a problem. So there's no downside in taking them separately.
If you missed that, that's the president saying that this change to childhood vaccines is happening, quote, "based on what I feel," unquote. Medical experts say the combined MMR vaccine is safe. They warn that separating the shots could leave children vulnerable to dangerous diseases between doses. According to the nonprofit Our World in Data, the measles component of the MMR vaccine alone has saved an estimated 94 million lives worldwide over the past 50 years. The CDC says about 93% of current measles cases in the U.S. are among people who are unvaccinated or whose vaccination status is unknown. Let's discuss with people who have their judgments based on science and medicine and not feelings. We have with us Dr. Richard Besser, the former acting director of the CDC. We also have with us Dr. Paul Offit, director of the Vaccine Education Center at the Great Children's Hospital of Philadelphia. Dr. Besser, to you first. What's your reaction to these major changes to the childhood vaccine schedule, including how many immunizations are recommended for a child's earliest years?
You know, Jake, I think the idea that the president of the United States would make these changes based on what he feels, flying in the face of decades of of science is it's absolutely unbelievable. I haven't seen anything like this in my career. I practiced pediatrics for over 30 years and would always count on the recommendations that came from the expert committee that advised the CDC to ensure that what I was doing was safe, was effective, and I could go forward to my patients with confidence and make a recommendation. What the president has done here is he's making another attempt to put forward a vaccine schedule that's based on the Secretary of Health's wild ideas about what should be. And it leaves our children really vulnerable. And there are a lot of children who are going to hear what the president, a lot of parents who are going to hear what the president is saying, and they're going to be confused, they're going to be afraid, and unfortunately, they're going to make some wrong decisions about the health of their children.
Dr. Offit, in addition to Donald Trump not knowing much about science or medicine, and RFK Jr., the health secretary, not knowing much about science or medicine, and in fact, thinking that he's right about a lot of things that he's flat wrong on, Stephen Miller, the White House Deputy Chief of Staff, had something to say about this during the announcement. Take a listen.
You give a kid shot after shot after shot, you're going to have vaccine injuries. You're going to have immunological issues. You're going to have potentially neurological issues. Why do you need to have these shots bundled into these packages? Why can't you split it into 5 visits and give this young body, if a parent wants to do a vaccine, 1 shot at a time?
Can you answer his question?
So based on what? I mean, we have looked at these questions as they've come up again and again and again. Do the fear, I think, that people like Stephen Miller or Donald Trump or Robert F. Kennedy Jr. is that children are just getting too many vaccines too soon, and that somehow is weakening or overwhelming or altering the immune system. But of interest, it's really not the number of vaccines that matters. What matters is the number of sort of immunological challenges in vaccines. I mean, so for example, 100 years ago, we got one vaccine, which was the smallpox vaccine. That was a greater immunological challenge to your immune system than the 18 different vaccines that we get today because of advances in protein chemistry, protein purification, recombinant DNA technology. When Donald Trump was born in 1946, he got 2 vaccines, the diphtheria, tetanus, pertussis vaccine and the smallpox vaccine. That was a greater immunological challenge than his son Barron got when he was a child.
Dr. Offit, do most of your colleagues who are pediatricians follow the Commonwealth of Pennsylvania's vaccination guidance, or do they look at federal guidance, and is that changing at all?
Well, so they look to the American Academy of Pediatrics. Most pediatricians look there and to their advisory body, which is the so-called Committee of Infectious Diseases, which has stood up for children and has a science-based recommendation, unlike that that's made by people like Stephen Miller or Donald Trump or Robert F. Kennedy Jr. It's hard to watch. Also, the Coke bottle, where does that come from? A dose of vaccine is roughly 1/10 of a teaspoon of a teaspoon, 1/10 of a teaspoon. So a multi-dose vial would be 1 teaspoon. Where's he getting this Coke bottle stuff?
He makes up a lot of stuff. I'm sure you know that. Dr. Besser, there have been extensive scientific studies of vaccines. No evidence of any provable connection to autism. Yet both Trump and RFK Jr. continue to say that there is a link. Take a listen to the health secretary earlier today.
So something happened in the mid-90s that changed our children, and it has to be an environmental exposure. Because genes don't cause epidemics. It can provide a vulnerability, but you need an environmental toxin.
So first, RFK Jr. said that it was thimerosal, which was an additive to vaccines, Dr. Besser. And out of an abundance of caution, that was removed. And now he's saying it's the vaccine. He keeps just adjusting his claim, and it's not based on science. What's your reaction, Dr. Besser?
Well, my reaction is that the secretary, by continuing to go down this path, is deflecting dollars that could be spent to ensure that the children who are autistic can lead their fullest lives. This is a distraction, and it is an expensive distraction, and it's a distraction that is instilling fear. The questions that he's raised about vaccine schedule, about timing, about the number, have all been addressed by science. But the fact that we've gone down this road, it started with a physician who's been totally discredited who raised up these claims a long time ago. They were addressed, they were studied, and they haven't been found to be the case. There's a lot of exciting work that has gone on to try and look at the various causes of autism, and a lot of more work that needs to be done to ensure that children who are autistic can fully participate in society.
Do you think it's likely, Dr. Besser, that this decision is going to result in lives being lost?
You know, I think that there are quite a number of people who are going to hear this, and they're going to be confused, and they're going to delay. And one of the things that I found to be miraculous as a pediatrician was every time a new vaccine was developed and was found to be safe and effective, that meant that there were children who I was not going to see with these diseases anymore. In my office, in the hospital, I was not going to have to talk to parents who were losing a child. And this instills fear where there shouldn't be fear.